Hi, my name is Arish. In this video, I'll be your respiratory therapist showing you some basic airway clearances techniques for cystic fibrosis. I will try to keep your lung as clear from the mucus as possible. We'll be looking at the use of a oscillating PEP therapy, the Acapella device. To use this device, simply sit up straight, rotate the end toward the plus to increase resistance, rotate the end toward minus to decrease resistance, as prescribed by your healthcare provider. Put the mouthpiece of the device on your mouth and be sure there is a tight seal around the mouthpiece. Breathe in slowly by taking a larger than normal breath, then hold your breath for 2 to 3 seconds. After that, breathe out through the device longer and a little faster than normal. Repeat this process 10 times with the mouthpiece in as tolerated for all 10 breaths, which is 1 cycle. Do 2 to 3 huff coughs to get rid of mucus. Repeat the whole process for 5 cycles or for 30 minutes as prescribed by your healthcare provider. A nebulizer can be attached to the Acapella by connecting a small volume nebulizer T-piece to distal end opposite the mouthpiece. Attach the corrugated tubing supplied with your small volume nebulizer to the end of the device. The tubing extends the body of the device to help contain aerosolized particles and prevent medication loss. Seal the mouth around the mouthpiece and breathe in through the mouth as previously described.